Yeah.
Okay, so she's got low back pain. So usually when someone's low back pain, I'm going to ask them one or two things: if the pain goes across the back or if it goes up and down. If the pain goes up and down, it's usually like a hip flexor issue, psoas. But if it comes across the back, then usually I'm thinking glute medius or the quadratus lumborum. So the first thing I'm going to do is I'm going to check to see if she's got tight hip flexors, and then we'll go from there. So tight hip flexor, I'm just going to bring her knee to her chest, and this leg should stay flat, and then vice versa on the other side. So when I bring her leg up, you can see his leg stays totally flat. So it's definitely not a hip flexor issue. This is called the Thomas test, by the way. So this one, I'm doing the same thing. Now look at this one. So this one's, now see how it's totally flat right now? As soon as I bring her leg up, you can see how that thing starts to pop up. So I know for sure this hip flexor is really, really tight. Okay. So now I'm going to have her leg. Yeah, so hold on a second. Along with that, I want to see what kind of hip movement she has in her glutes. That's pretty good. Let's see if this one's tighter. Not too bad. And then I'm going to look at adductors to see if she's tight. That looks good too. So actually, so literally it's just that hip flexor on that one side. Actually, this one's a little tighter. Okay. And now go ahead and lay in your stomach. So now what I'm going to check is I'm going to check rib height. So I'm going to check to see if one rib's lower than the other rib. And this is the same hip that was tight. This rib's lower on the right, and the hip's higher on the right-hand side too. So I know there's a lot of compression going on inside here. And now I'm just going to kind of feel her glute medius. It feels tight right in here on both sides, especially right there, right? Yeah. So glute medius can definitely shoot pain up into the low back. Okay. I feel tightness right here a little bit, but right there it's really, 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 really tight. So go ahead and lay on this hip. Another thing you can do to test this is just do a muscle test. So you put the legs totally straight, lock the knee out. Now I'm going to push the leg straight down to the ground and have you resist, so push up hard. So this one, if it's weak, it'll just go weak. So now what I'm going to do is I'm going to stretch it all the way out. Because if it's too tight, you stretch it out and you bring it up again, you resist me, she'll have a harder time holding it. And right there she can hold it at all. Because her glute medius is way too tight, and it's way too tight right there. And go ahead and lay on your back now. Now for the QL, if you want to test to see muscle testing wise, is I'm going to have her hold onto the table. I'm going to take the legs to this side, and then I'm going to push this way and have you resist me. So resist me, push out hard. No, you're going to push out against me. There you go. Perfect. Go ahead and relax. So now I'm going to push out again. Push it, resist me. And now she holds good. Let's go to the other side. Resist me. And you can see how she can't hold it at all on that side. So like I said, QL, glute medius, hip flexor are all the ones that are tight. Okay? So what I'm going to do is come in here with my elbow. You're right on the hip flexor. And I'm going to start loosening this area out. And it's going to be pretty dang painful. You okay? Mm-hmm. You can start it off now.
Like what?
You can stop it now.
Okay.
So with the hip flexor, the reason why I check the hip flexor for low back pain is because the hip flexor literally starts right here, but then it'll dive through the abdominals, and then it literally attaches to the low spine. So people that have tight hip flexors will have hyperlordosis, or they'll have that really pronounced arch in their back, low back. And then if one side's tighter than the other, you can see how it can pull one side more than it pulls the other. So I'm just going to continue to loosen up the hip flexor so that it's not pulling literally the lumbar spine and towards me.
Want me to stop it?
Yeah.
Yeah.
Nearly as much.
Yeah.
Where do you feel like it's still got pressure on it? In here, kind of still. So the way we're going to check to make sure that her hip flexor is nice and loose now is the same test as before, except before it was kind of coming up like this. This time it should be totally flat because we've loosened up the hip flexor. Now I bring her knee into her chest, and you can see how it doesn't move at all. So that's good. So now what we need to do is glute medius, and then her QL won't be done. So go ahead and lay on this hip now. if we recall, most of the pain was right, kind of on this corner right here. So I'm going to literally get in here with my elbow on that spot. We're going to loosen up a couple of these areas that are really, really painful and tight.
You want me to stab it?
Just a little bit longer.
Yeah.
And what I want to do is, I know that her pain is all close to this hip bone, but this muscle runs from here all the way to the sacrum. So sometimes you got to run from here all the way down. But for her, I'm basically going to work just in this area right here. You can turn.
And go.
So the way we're going to test the glute medius to make sure that it's sufficiently loose. Even feeling it now, it feels a lot looser. She's probably tender because I worked out all those muscles, so it probably doesn't feel great still, but it's definitely way looser than before. So the test, we're going to do the same thing. Have her resist me, so push up hard. And then we're going to stretch the whole thing out. And then redo it, resist me. And now she's holding it strong. So that means that it's pretty good. She probably needs a couple more treatments, but it's doing a lot better than when we first started. So now with the QLs, what I want her to do is have her arm over her head like this. So I want to create space between her ribs and her hips. And to get to the QL, the best way to do it is to come straight down like this. And the QLs could be painful right here, but it can be painful right next to the spine too. So you got to kind of like drill your way down and loosen up all the area. Might be an area of tickleness too.
Yeah.
So I'm gonna try to go in a little bit more pressure. With a little bit more pressure, usually it's not as ticklish and just more painful. But there's definitely something right there. You doing okay?
Mm-hmm.
Okay, you can stop.
Go.
So to check to make sure that the QLs, by the way, the QL, what they do is the quadratus lumborum attaches to the top of the hip and it goes to the spine, and attaches to the bottom of the rib and it goes to the spine. So they crisscross like this, and that's what allows the person to bend their body side by side, basically like this. So what I'm going to do to make sure that it's loose enough is check the rib height. So now the ribs are even there, and the hips are maybe a little bit higher than right, but not bad at all. And then to muscle test that, go ahead and lay on your back. We're going to do the same thing as we did last time to make sure all the muscles are equally firing. So we're going to start, go ahead and grab the side again. So we're going to start this way. I'm going to push back. You resist me? Okay, relax. Okay, resist me? Nice. Okay, one more time this way. Resist me? Okay. So last time she was just going straight over. So that's basically the three muscles that worked should clear up the problem for her, and should cause her to have less low back stiffness and tightness and everything else.